All right, good morning. It is Monday again, June 15th, 2020. I want to thank everyone for being on the call. As you're logging in here, just if you could, please silence your phones. And the reason we want to do that, although I have you on mute, I do want to open it up for questions at the end. So if you have your phone muted, it will be easier for the person to ask questions and for everyone else to hear the answer. So I know you're working, I know you're in the background doing your thing and listening, and I really appreciate that. But if you can place your phone on mute so everyone else can hear the questions as we get them answered. Just as a reminder, we are now on YouTube. So if you go out to our YouTube channel, just type in Health Plan Markets, and I am hosting all those calls on YouTube. So if you need to reference back into one of these calls, one of these video recordings, you can go ahead and do that. I am now leaving the actual topics in the description. So if you're not sure what video is hosting what you're looking for, you can look in the description, and that will be able to help you find what you're looking for. This morning, I'm just going to do a quick overcap on what we're going to talk about this morning. Obviously, we're going to talk about our office hours, the trainings that are on deck for this week. I'm going to talk about Aetna, the certifications that are coming out. I'm going to talk about Clover, what they're doing for COVID-19, and text alerts. We have some contests that I want to make you aware of, and we're going to talk about COVID, 5-star plans, and then I have some marketing ideas on how we can generate leads online, especially helping people apply for Medicare and Social Security. I'm also going to talk about a very, very important topic that I think we kind of glaze over sometimes, and that's what's the difference between Medicare Supplements and Medicare Advantage plans, and then, of course, our referral program. So from the top here, the first thing is our office hours. We are back to normal, so Monday through Friday, 9 to 6. If you need anything, we are open for business at both locations in Orlando and Jacksonville. We're here to support you on that. Again, we're also available by phone, email, text message, flare gun, pigeon, whatever it takes. We're here to help you with that. So we're back to business. So if you feel the need to come on in and grab supplies, please don't hesitate. We do have the office open for you. Training. So there's lots of interesting things going on this week for training. So I'm going to go ahead and go through that training with you. The first thing is Devoted Health Plan is starting their rollout sessions. Last year and years prior, we always loved going to these events because you get to meet the folks from the health plan, you build relationships, and you get out of the house. But unfortunately, it looks like most of these rollout sessions are now going to be hosted online, virtually. So Devoted is starting at 11 o'clock this morning. They're the first ones out of the gate to show plan benefits for 2021. So go ahead and join that at 11. It is by Zoom. So you just jump on our training calendar and the link is there. That rollout session is specifically for Polk County, the Orlando market, and the Villages market, which is brand new for Devoted Healthcare. They are entering Lake County, Marion, and Sumter counties for next year. At 1 o'clock, Humana is hosting a veterans training. Outstanding training if you want to get more information on how to market and serve your veteran clients. They are a leader at veteran training, so I love when Humana hosts those. At 3 o'clock, United Healthcare is hosting their application for electronic enrollment called their Lean application. So they're doing a live training session. If you need to brush up on that or if you're new to Lean, definitely a great training there. And then last week we talked about dental plans. Humana is hosting a dental Webex today also at 3 o'clock. So if you're looking to add dental to your portfolio or again brush up on what Humana has to offer on dental, that's today at 3 o'clock. Tomorrow, mañana, Tuesday, June 16th, 10 o'clock, we've got Bright Health. They're doing their rollout session at 10 o'clock, and that's virtual as well. It is a Zoom meeting, so jump in there and you'll be able to see all the great things that Bright Health is rolling out for 2021. Tomorrow at 2 o'clock, Humana is hosting how to do their telephonic enrollments, their enrollment signatures IVRs and their scope of appointments. Now, just to be clear, Humana calls their IVR is an automated scope of appointment system. So you call, a computer answers, and you go through the prompts and you get your client scoped. So you don't have to wait for anything, and you can do it remotely. So it's a really cool tool, especially if you've got your client on the line right now. You can scope them immediately. You just connect with a three-way call and it's done. It's a little awkward, I'll tell you, talking to a computer, obviously, but you know, it gets the job done. So if you're interested in that, it's a great tool to use. On Wednesday, the 17th of this week, at looks like 9 o'clock, Humana is hosting a very early session there for how to help your clients with assistance from the state and federal benefits for prospects. This one's specifically just for Florida agents, but even if you're not in Florida, a lot of these programs and ideas may still be relevant in your market. Medicaid does differ by state, but a lot of the federal programs are available in all other states. So still a good training session on Wednesday at 9 o'clock from Humana. On noon on Wednesday, you've got United Healthcare. They're hosting how to build your business plan. And we've covered this before, and getting into this, getting out of this awkward time from COVID and everything that it's caused with, our business disruption, and then finishing out the rest of the year strong and having a game plan for AEP. You can't go anywhere unless you got a plan. So, take advantage of that business plan building course. That's on Wednesday of this week at noon. Great session. That's hosted by United Healthcare. Again, they're going to talk about how United can help you with all that, so that's great too. And then on Thursday at 10 o'clock, this is June 18th, Thursday 10 o'clock, Humana is hosting their duals on their products, how to market their dual products, the basics of their dual plans, and of course Medicaid and how that all ties together. And Friday of this week at 9 o'clock, Humana is hosting their dental and vision product training. That is a Webex at 9 o'clock on Friday. So that's the trainings for the week. Again, I hope everyone takes advantage of trainings. Although sometimes it can feel overwhelming, you always have to remember, keep one foot in the classroom and the other one in the field at all times. I don't care if you've been doing this for 5 days or 5 years or 15 years, there's always something new to learn. And that's what's so great about our business. All right, so let's jump over to Aetna. Aetna's got a lot of updates here, so I want to give you some updates here. Their 2021 certification will be live on July 1st. So that's another one out of the gate that has a date. Aetna certification will be live on July 1st. And for the first time, Aetna and SilverScript, which is their PDP product that they bought a couple years ago, will be in the same portal. So you'll be able to access your SilverScript training, and you'll be able to access your Aetna training all in one place. However, they are still two separate certifications. So you can't do SilverScript and get certified for Aetna or vice versa. You got to do both training sessions to be certified for 2021. However, both certifications live in the same portal now, so that makes it a little bit easier so you don't have to log into two different places. They do now have pre-filled electronic kits, or what they're calling e-kits. Why is this important to you? Well, let's say you have a client that says, yes, I am interested in Aetna, I want to enroll. Well, you can go ahead and go through your portal and send them an entire electronic kit by email, and everything, all the compliance documents, the enrollment instructions, and everything are already pre-filled for them. And it has your information, so you get full credit, of course, and it looks really, really professional. So that's a nice little thing that they're doing on their e-kits. Makes it easy to get that information out to your clients so you don't have to fumble with scanning documents and sending it over and yada yada. It makes it really, really easy. They also, I want to remind everyone, they do also have a value-based enrollment credit of $50. So they call VBE. And what is a value-based enrollment? The value-based enrollment is basically that physical that you're doing over the phone with your client. It's a questionnaire, what we call a health risk assessment on the medical side. It basically gives your clients and doctors that first communication, and it gives the doctors a snapshot of what's going on medically with your client. So it's really important, especially when they're first enrolling with a brand new health plan and a brand new doctor. That VBE is a great tool for the doctors and the health plans to maintain their star rating and improve their star rating. So it all circles back around. You know, when we get 5 stars, we get to enroll year round, we make more money, so on and so forth. But that VBE credit of $50 goes directly to you. You do not get a chargeback. So even if your member decides to disenroll, you get to keep that value-based enrollment because it's not considered commission. It's actually considered an administration fee because you're doing administration work on behalf of the health plan. So that's why you get to keep that $50, and it literally takes less than an additional 5 minutes, maybe even like 3 minutes to fill out that 1-page form with your client to ask some medical questions. And that again is on the electronic application, so you don't miss it. It gives you that you know, it's free money, $50. You know, if you're doing quite a few Aetna apps, let's say you do 10 Aetna apps a month, you're getting an additional you know, $500 that you don't have to worry about. So I think it's worth it. Also great. And then of course they have downloadable PDF kits that are pre-filled, so you can put in your information, your agent information, and you can download a PDF version of the physical kit that you can keep and distribute to your clients. So another great tool. It looks like Aetna's really stepping up their game on that. I love that. Clover, for those of you in the New Jersey market that are selling Clover, they've made an announcement that for the COVID-19, they are waiving their copays on prescriptions for Tier 1. So there is no more copays on the prescriptions. They're the first company to waive copays on prescriptions. Excuse me, I thought that was a pretty interesting thing to do. A lot of the other companies are waiving copays to the primary care doctor, to the specialist, and so on and so forth. But they're the first one to waive on the prescription. So if you have a client in your market that is, you know, struggling to make ends meet on the prescription drug plan, maybe Clover might be the best plan for them. WellCare. Now, WellCare has a program called the RFI, which is a request for information. And the request for information team is a team that reaches out to you to basically gather more information that may be missing on your application or is not matching the CMS system some way or somehow. So what they normally would do is they would send you an email or your manager would reach out to you. Now you can set up text message alerts. So for instance, how would this help you? Let's say for instance that you submit an application for WellCare and WellCare has, you know, they're missing, maybe you missed the date of birth on the application when it was submitted, or the date of birth was wrong, maybe you had it transposed. So instead of, you know, waiting a few days or whatever, when they click a button on WellCare side, it'll send you a text message saying, hey, we're missing information on this client, please give us a call. And right from your text message, you can click the phone number and you dial out to WellCare and you'll reach somebody to help correct that application. So I think that's an excellent communication tool on behalf of WellCare. So text message alerts are available on your RFI. I believe you're automatically enrolled in the text message alerts if you are active, certified, and ready to sell for WellCare. But if you have any doubts and you want to ensure that you're set up for that text message service, you can reach out to their broker support line or reach out to one of your local sales managers and they'll be able to help you with that. All right, contests. So we have a couple of contests for you. You know, for the last couple of weeks, I've been sneaking in some contests for you guys. Anyone that's been on the calls this morning, on Monday morning conference calls, and we have a deadline for 11 o'clock for this contest. We did a $10 Amazon card. I'm still distributing those, but we have a $10 Amazon card this morning. I've got another one for you. If you leave us a review on the Better Business Bureau, and you can find it, type in Health Plan Markets. If you leave us a review, I have a $10 Amazon gift card, but the catch is you got to do it before 11 o'clock, and you must only say nice things. No, I'm kidding. Honest reviews are great, you know, just go onto the Better Business Bureau, type in Health Plan Markets, you'll find us there, and leave us a review. And I have a $10 Amazon card. But again, it has to be done by 11 o'clock this morning, and I'll get you out that Amazon card. So really appreciate that. All right, now, as you know, we're still in an SEP for Medicare for COVID-19. That ends on June 30th, so you have the rest of this month to enroll anyone and everyone that has Medicare. Let's say they missed open enrollment. Let's say that they just forgot. Let's say they, you know, they just want to change their plan because it's not what they thought it was when they enrolled during AEP or OEP. You do have an enrollment period now. All you have to do is select FEMA, which is the emergency disaster. Most of the plans have that on the application. It's now available there. If you don't find that, you can select other, and then you'll type in COVID-19, and that will fly through to CMS. So, you know, you still have the ability to enroll people. And again, it's only for July 1st effectives. You cannot future date it to August or September. They have to be effective July 1st. So you have 2 more weeks of this free SEP. It's like open enrollment right now for everybody on Medicare. So you want to get out there and you want to do marketing. So let's talk about marketing. What can you do right now, low-cost marketing, to get your phone to ring? Well, a couple ideas that I was talking to some agents last week on some great ways that we can help get to folks online, and social media seems to be the winner. It's free, it's easy to use. Most seniors are on there anyway, checking on the grandkids, and you know, spying on what's going on with the family. But they're there and they're willing to listen to you. But you have to have good content. You know, you have to have something that's going to help them, something that's on their mind, that's going to ease their pain. And one thing that I could think of, you know, just for this week, one topic would be helping those people apply for Medicare. Now, there's people that are 64 years old or just turned 65, and a lot of people are automatically enrolled, but there's some that are not automatically enrolled. Unfortunately, there's no rhyme or reason for this. So what you can do is become an expert at helping people apply for Medicare. Okay? So you have to go out to Social Security, you have to click the Apply for Medicare button, and go through that yourself first before you start putting yourself out online, and get familiar with how to get to that application, how can you help people apply, and that will help generate leads because people will come to you to apply for Medicare, and excuse me, and that will again lead to somebody choosing a plan, right? If you're the one that helps them get their Medicare Part A and their Part B, where else are they going to go once they say, yeah, I've got this, but I'm still in the hole for 20% in the deductibles and all the other things? It's a great opportunity for you to lower that sense of trust and get out there and do some community service anyway. And even if they don't enroll with you, you've got that good feeling inside of you. You're going out in the community, you're helping people get applied for Medicare. I don't see a reason why they wouldn't enroll with you after you've done all that work with them. Of course, we've got some crazies out there that do what they do. But get out there, help people apply for Medicare. And imagine that post on social media. It says, I can help you apply for Medicare. If you have Medicare questions or how to get started with Medicare. And that will get your phone to ring. You know, you're going to get messages on Facebook, on Twitter, or wherever you're at, Instagram, and people will respond to you and they'll say, hey, look, I'm about to turn 65 in 2 months or 3 months, and these are T65 leads, guys. These are people that are big money for you, and they're willing to get help from an agent. So putting yourself out there and saying, hey, yes, we can help you apply for Medicare. We can help you get started. And then once that, you know, magical red, white, and blue card comes in the mail, you've already primed them. You said, hey, once you get this card in the mail, you're going to call me, and we're going to go through some plan options with you. So low barrier entries, you know, take that step back and look at your marketing and say, yes, I can get out there and help people apply for Medicare. I think that that's an awesome way to generate T65 leads, okay? And if you're interested, you can run ads on Facebook, and in the demographics you could put specifically that I only want to target people 64 or 63 or just turned 65 or whatever, and you can put that out there as an ad, and they can actually advertise your post, so you don't even need to have creative on this. You can simply just, create your post, and then there's a little button that says boost your post, and it'll walk you through on how to, put in some money. And if you're getting sales, if you're getting success, and we see that, you're spending some money, we'll be able to back you on some of that stuff. So put that together, see if that works for you. Just one great idea for marketing right now that can get your phone to ring, and that's the whole idea. I do want to cover something that was brought up to me last week, and I kind of glaze over it a bit on how important the difference is between Medicare Advantage and Medicare Supplements. And the major difference here, and I'm going to cover this in a separate video altogether because I do believe that this needs to be touched on quite often. And as sales folks, we get wrapped up in all the frills and the benefits and all the things that might seem exciting to your client, right? Like free gym memberships and over-the-counter credits and money back on their plan and transportation to the doctors. And all these frills about Medicare Advantage separates them from Medicare Supplements. Now, we also know that Medicare Supplements, you basically pay a monthly fee and you don't have to worry about network, and you can go wherever you want, and you can travel throughout the states, and pretty much everything's paid for depending on what plan you have, right? Well, the major thing that's missing here is what is the major difference between Medicare Advantage and Medicare Supplements? It's managed care, okay? The managed care approach. And the difference is if you have a Medicare supplement, yes, they will pay all your doctor bills. They will make sure that, everything's paid for and you don't have anything happen with collectors, right? But once they pay the bills, they're done, okay? They're not going to call your doctor. They're not going to pull your medical records. They're not going to do any of that. And that's the difference on Medicare Advantage. The true value of Medicare Advantage is the managed care approach, okay? So I'll give you an example. Let's say Mrs. Jones, 85 years old, her kids live in a different state, and she has a slip and fall in her home. She calls 911. Somebody calls 911 for her, and she goes out to her, they pick her up and they take her to the hospital. Well, yeah, the supplement's going to pay everything, but when she's on Medicare Advantage, as soon as they hit that hospital, they're going to swipe her card, and they immediately contact the plan. They immediately contact their primary care doctor. They immediately sign a case manager to her to coordinate her medications, her specialist visits, her post-care, her post-acute care. They're going to even coordinate sometimes transportation back home because she didn't drive there. And those are all things that are missing from a Medicare supplement. And in my opinion, it also feels like you're buying a Cadillac with no engine in it when you buy a Medicare supplement. Now, I'm not saying that Medicare supplements are bad. All I'm saying is I want to ensure that people understand the difference and what you're truly getting with a Medicare Advantage plan. Because that is a big thing for people. If they know that they're going to get care outside of their own family, then maybe they'd lean towards the Medicare Advantage plan, even though, they're thinking in their mind that supplements might be better. And just because you pay for something doesn't necessarily mean that it's better, right? So supplements, in my opinion, are fantastic for people that, truly want to have free access because they travel a lot. Maybe they travel between states and their kids live in one state and they travel all over the country. Supplements would be fantastic for that. Also, somebody that's really, really, really sick, probably going to want to grab a supplement if you can. However, everybody else really should be taking a look at Medicare Advantage plan because, you've got options for PPOs, which work very similar to a supplement where you can, go in and add a network. Yes, there are restrictions. Yes, there are limitations to both of those things. But the true value of Medicare Advantage plan, I don't want anyone to forget, is that managed care approach, is making sure that the member is getting true care at the end of a major situation. And those, unfortunately, those are just things that you really don't get with a Medicare supplement. So again, I'm not saying anything bad about supplements. They're great for those folks that I mentioned. But Medicare Advantage, you know, I just want to make sure that everyone knows that, because it's really, you're going to see as these benefits roll out this year, you know, everyone's got these frills. But the core, the meat and potatoes of these Medicare Advantage, so the reason that we offer these products, and I'm so passionate about these products, is because they truly, truly help people, and they have that managed care approach. So don't forget that. And again, I'll dive deeper in another video on all those differences there. But and then lastly, I'm going to leave you with, we do have a referral program. We are onboarding new agents in different areas. So if you have friends in other areas or agents that are just not happy with their agency or their FMO, we are now hiring. We're not going to go crazy. We're just looking for a few good men or women out there. So, you know, if you have a friend, family member, or somebody looking to get into the business for the first time, we're able to help them as well. We have a referral program for you. So once they onboard with us, they have to contract with at least 3 carriers, do 3 sales within 3 months, which is 90 days. We have $300 referral credit for you. So it's our 3-3-3 program, pretty easy to remember. So once more, they contract with 3 carriers, they do 3 sales within 3 months, and I've got $300 for you. So, so that's that for this week. I'm going to go ahead and open it up for questions. So here we go.
Mark, Justin, it's Mark. I have a question.
Yes, sir. Good morning, Mark.
Yeah, I registered for the Humana Dental webinar today, but how do I access it? They didn't send me a link or anything.
Well, they should have sent you an email link, but if you don't have that link, we do have it listed on our training calendar, and you should have a link to our training calendar where all those links are. So when you open up the actual event, there'll be a link in the description. You just click that link and it'll open it up for you.
Okay, thank you.
Yeah, you got it.
Justin, this is Steve. I have a question.
Yes, sir. Good morning.
I missed the Humana Facebook training the other day. Is there any backup to accessing that or going through that again?
It doesn't look like they have anything upcoming. It was kind of like a test. Actually, I'll tell you what. I just looked forward for next week, and next week they will have one on Thursday at 3 o'clock. Not this week. Next week, June 25th.
Thank you.
Yeah, you got it. And it doesn't look like a lot of these trainings are being recorded right now. We have asked them to record them for us, but some of the carriers are able to do it, some of them are not. So that's why I'm letting you guys know every Monday of the trainings, because they may not be recorded and they may not be available in the future. So that's why I always say, hey, look, you know, go out there if you have time, especially if it's of interest to you. Make sure you cut out some time for yourself and get that done. But yeah, there's another one coming up on the 25th at 3 o'clock. All right, any other questions this morning? Fantastic. I appreciate everyone being on the call this morning. As always, we are hosting these on YouTube, so you can go out to our YouTube channel and look for Health Plan Markets. And once you're there, make sure you hit the subscribe button so you're notified once I post these videos in case you miss a Monday, and turn on your notifications so that way you get a text message. I think they send you a little notification in your cell phone if you're signed up through there, but they'll also let you know when the videos are available. So make sure that you hit that subscribe button, and we'll make sure that we keep bringing these to you. So I hope everyone has a fantastic week. Thanks again for being on the call, and have a wonderful, wonderful Monday.